Trichotillomania is compulsive hair pulling, where people pull out their hair either from their head, their face, or anywhere in their body in response to either a habitual need to pull, a compulsive feeling, or anxiety. When people with trichotillomania pull their hair, they're often looking for different things. Some people look for the sensation, some people like to see the hair, and some people actually will nibble off the end, the follicle. The most common places that people pick their hair from in trichotillomania is their head, but we also see a lot of eyebrow and eyelashes. We can see arm hair, leg hair, and sometimes even pubic hair. Most people aren't born with trichotillomania. It's something that can develop in childhood and adolescence, and it's usually in response to some sort of trigger of anxiety or stress.
The DSM-5 classification classifies trichotillomania as obsessive-compulsive disorder. This includes recurrent pulling out of one's hair resulting in hair loss, repeated attempts to decrease or stop the pulling, pleasure, gratification, or relief when pulling out the hair, and the pulling cannot be better explained by the symptoms of another mental disorder. Finally, the disturbance causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. The causes of trichotillomania mainly relate to negative feelings. Pulling out the hair may be a way of dealing with negative or uncomfortable feelings such as stress, anxiety, tension, boredom, loneliness, or extreme tiredness and frustration. Prevalent studies suggest that trichotillomania is a common disorder, although it is grouped with the obsessive-compulsive disorder in the diagnostic of the DSM-5. Trichotillomania is distinct from OCD in many respects. However, it is still seen in about 0.5 to 2% of people worldwide. Approximately 1 in 50 people experience trichotillomania in their lifetime. Often those who struggle with the condition keep it hidden as much as possible by covering the areas of the body that are affected. Patients suffering with trichotillomania often develop the urge to pull around age 12, and around 82% of those affected by it happen to be female. While there isn't much research out there, recently, as of 2023, the University of Chicago Medicine has found a drug that is commonly used to treat symptoms of Alzheimer's disease, and it effectively reduced symptoms of adults who experience compulsive hair pulling or skin picking. Treatment with the drug memantine was associated with significant improvements compared to a placebo for patients with trichotillomania.
The treatment for trichotillomania is a combination of cognitive behavioral therapy and habit reversal training. So habit reversal training really works on limiting the stimulus and working on developing replacement behaviors for the trichotillomania, as well as providing reinforcements for not engaging in the hair pulling behavior. So especially with younger children, we may do something like a reward chart or a reinforcement behavior chart in order to minimize the hair pulling experience.